Assalamu alaikum. Can everybody hear me in the back is the first question. Thank you. And apologies, you're going to see my back, but I appreciate it. So assalamu alaikum, everyone. I am Sarah. I have grown up in Bay Area when I was little, and I know several of the individuals here, like Barbie Nanti, from when I used to live in like the San Jose area. And thank you so much to BWE and Lena Auntie and everybody on the board to invite me to talk about this. I'm really excited to be having this talk because the questions I've been receiving has been telling me like why what I'm talking about is going to be so relevant. We're going to have a lot of fun. So before I get started, I'm going to do a little bit of audience engagement. So I'm going to talk about addiction medicine today and how it impacts health. How many here, I'm not going to make you raise your hand physically. You're going to raise your hand, if not physically, in your mind. Who here is wondering about what does addiction have anything to do with women's health? I just want you to think about it. If you're brave enough, raise your hand because thank you so much. This is a question that I've had, and even my mom, who thankfully is here today, I was giving her like a demo presentation and she's like, why are you going to talk about this to this audience? So, okay, second question is who here thinks addiction is a mental health issue? Okay, appreciate it. And who here believes that it is also a physical health issue? Good. I appreciate it. And my co-panelists, I'm sure you have seen the impact of addiction in OB, in family medicine, and at all spectrum, especially with healthcare costs. And I really love what you did, Dr. Ivy. I don't think we have much data in our population, but I know when I'm treating my patients with methadone for opioid use disorder across California, I actually do serve patients from, Stockton, Modesto, and I see a lot of names that are our types of names, So I know that this is not something that is just an American problem. It is also a people of color problem as well. So you'll see me at times looking at my cheat sheet here. So talking about the impact of addiction on women's health, especially us South Asian women. We come from a culture where the concept of mental health is a taboo topic, right? Who here feels comfortable saying, I have depression? Who here will say, I had postpartum depression, it sucked? Did anybody have a bad time raising their baby afterwards? I appreciate your bravery. Thank you. We need to talk more about this. And you can also get postpartum anxiety. If you don't believe me, ask our lovely OBs here, right? I know I had it, and it felt like an elephant was sitting on my chest, and I had to take some benzodiazepines because it felt like I was losing my mind. And even though we all experience postpartum depression or anxiety to some extent, we don't have the social support for it. So these things are real. And when I have patients that come and tell me, I just need to detox, I know my brain, it's all in my head, I'm gonna get done with it. And I tell them, I agree with you. It's all in your head. It's all in your head. And it's not just in the mental part of your health, in your brain, it is also in your physical brain, okay? So our brain is also a physical activity. And I had a wonderful conversation before this with Kantapu. We were talking about chemicals, about not wanting to take medicines that we don't need to put in our body. And one of the things I told her is what my 6th grade teacher told us, is that the body is a bag of chemicals. Believe it or not, we're made up of chemicals. And what happens, where do we see these chemicals and chemical reaction? The fact that you're looking at me right now, there's a chemical reaction happening. And it is happening in your brain, okay? So these hormones that you guys saw a little while ago, the FSH, LH, progesterone, estrogen, they all have components that have a chemical formula at the end of it. So what is happening with drug use is it's coming in and it's impacting the way that your body's chemical balance is. Okay, before I come back to that, I'm going to go back to the first question. What does this have anything to do with you all here? You all come from great families. You don't have any problems in the family. Your kids are perfect. Your husband is perfect. You are perfect. Your parents did an excellent job raising you because they sat you down and they told you, okay, right? So biri, or tobacco, is one of the substances. And it is probably one of the most commonly used substances that we abuse in our culture. Fortunately, we have the protection of Islam in the way that we are raised, and we avoid alcohol most of the time. But now that we're here, we go to school, medical school, you turn on the TV, you listen to the song, you can't hear or watch anything that will not infer to drug use. Justin Bieber, lots of songs about being high. I like him. His songs are actually pretty cool. Billie Eilish, love her, God bless her soul. But you know, any popular people, Keisha, the songs are filled with drug use, the feeling of high, which in medical terminology is called euphoria. And that is one of the reasons why people will want to use substances, because oftentimes people come from situations, they experience things like trauma, like rape, like abuse, neglect. We have social abuse, such as social injustices, incarceration. And it's a huge, huge problem in the American population. And we experience it at times as well. And then something very common to our generation, with parents coming from back home having a lot of cultural baggage and they can't relate to you in school. You go to school, they say like, hey, let's go date, let's go have fun. Oh, here, Papa, can open and have a drink, just take a whiff. It's not going to do anything bad. And then they come home and then they see that their parents can't relate to them. Sometimes the parents might have their own issues with each other. So going from all that, they don't have anybody to talk to. And if they talk about mental health issues, it's like, oh, that doesn't exist, just toughen up, And then my favorite is, if you are Muslim, you have Quran, you have Allah in your life, you don't have depression. So if you say it that way, that God is the solution to your problem, right? So how does that make you feel as a believer? There's a deficit in you. Something is wrong with you, that you're not religious enough. So there's that layer of criticism and obstacle and barrier to care. Other times you might feel the impact of substance use, but not even realize it, is if your loved ones have it and they're not coming and they're not telling you, but the impact of it, you might feel it. For example, domestic violence is big in our community, and sometimes you have spouses or husbands will go drink and or gamble and come and take it out on the wife, and that is seen by the kids. And the kids go to school, they don't have any help, they come home, they see a disconnected family, and then guess where they will turn to next, right? So it can continue. And we might also have people in this room who may actually have substance use disorder. How many of you will be like, I have a kid and they have substance use disorder? Will you feel comfortable sitting in this room next to a person who needs help because you don't know what to help them with, or asking for help, right? So this is why I want to talk about it, because here's some statistics. I wrote it down because I can't remember names and I can't remember numbers, so I'm just going to read it off to you. So the first one is, since 1999, we have lost 1.25 million people to overdose deaths. That's a lot of people. And 51.2% of people age 12 plus, so 12 and upward, 51.2% people have tried illicit drugs. And so going back to the death thing, so we talked about since 1999. So what does that death look like in 1 year? 105,000 people die every year from opioid use disorder. So if you're dying That's physical help. Okay, who here still needs convincing that addiction medicine is important to talk about? And especially, you still have questions. No worries, but I would love to have questions during the Q&A session, okay? So I hope you see how important it is. It is important as women's health, and something that us osteopaths like Noyan and I, we are taught in osteopathic training. We have a special set of education that we have to do in addition to everything else, is learn about osteopathic principle, which is a very holistic principle. And it says that the body is a unit of mind, body, and spirit. So you can't just focus on the body by neglecting the mind or neglecting the soul. You have to have balance in all these dimensions. And that is how we love to practice. Okay? So next, so I think we talked about stigma, both of those top ones all together. Other stigma that I see, I'll save it for another audience, but some of them are people believe that they don't need medicine. They don't want to switch one drug for another. And I've gone on many podcast shows, and we have talked in detail about this, that chemistry, our body, nature, everything is designed to seek balance. And when there's balance, you have that optimal range. Now, this is engineering talk coming in. Everything functions perfectly within a range. And that range is where our body, as well as everything in nature, needs to be to perform well. And so when you have this influx or coming in of medicine or substances illicit, whether for treatment or for recreation or food, right? When you have something being put in, it will push the chemical reaction in a certain direction. You stay in that range long enough that is outside of your normal range, your body shifts its new range to that calibration. So kind of like the thermostat, it will reset itself, and then you stay in disease in the absence of those extra substances. So what we're trying to do with medicine is bring everything back into the balance and the homeostasis. This is where you want to be. And so if you need medicine temporarily to push you into this normal range so you can figure out your lifestyle and stabilize it, and then you slowly get rid of the medicine you don't need, if it is possible. Sometimes you need medicine for the rest of your life, and if that is, that's a treatment, right? That's taking care of yourself, not abusing yourself. So different types of addiction. I mainly work with substance use disorders, but there is also behavioral addiction, like gambling, porn addiction. These are the ones that are recognized right now. I know people can ask about what about game addiction and etc. We haven't gone into that part yet. Like research is still developing in that. So I'm going to focus more on the substance use disorders. There are different types. Main one is tobacco. We talked about that. Very common in this country is also alcohol use disorder. These two addictions, they're legal and they're the deadliest and the most available to people. Next, we have now marijuana, but then next big one is also opioids. You might have heard of fentanyl. Before fentanyl wave, we had heroin. And now a new emerging one that's coming out. People think it's safe because it's herbal, so it's natural. So people are doing kratom, and you can buy it anywhere right now. Kratom, Kratom. Kratom. You can now buy it legally at smoke shops, and it gets you addicted. Yes. The other ones, common ones, are sedatives. These are like the anxiolytics. These can be prescribed to you. Take it long enough, your body will it's normal for it to become dependent. Cut them off without proper support, proper weaning, then you'll go and turn to addiction. Because when your body feels bad, it's going to give you withdrawal symptoms, which is making me jump to the signs of addiction. So withdrawal symptoms, you'll feel headache, you'll feel achy, you'll feel just bad, irritable, depending on what you're withdrawing from. You can have diarrhea. Alcohol and benzo can have deadly withdrawal symptoms of seizures. That seizure can kill you. So a whole bunch of different things, nausea, vomiting, diarrhea, just miserable. You hate people around you, and people don't understand you, and it's very uncomfortable. And so another thing I want to talk about is pseudo addiction, because some people, they're like, oh God, you're going to talk about addiction. Are you going to talk about sugar addiction? Right? No, the answer is no. The reason I'm not going to talk about sugar addiction is because that is a dietary choice. So we're going to define what addiction is right now. So the way we define the disease of addiction, okay, it is when your body becomes dependent. So in the absence of it, you have symptoms. And it is impacting you in such a way that your life basically comes to a halt. You don't show up for work, you don't show up for your family, you don't show up for your obligation. You're going to go break into a car, you're going to break the law, you're going to sell illegal stuff to get the substances that you need to feel good. That is addiction, the disease of addiction. Addiction can start out as an acute phase where you're just trying to escape the surroundings around you because nobody understands you, or you want to forget all the horrible things that happened to you. You start in a short way, and then it becomes a chronic disease like diabetes, like high blood pressure, and you need medicine at that time to help you stabilize and slowly come off of it. So that is addiction, and it basically hijacks your reward pathway. Reward pathway, and this happens in the brain, in the the very basic part of our brain that motivates us to eat, sleep, procreate. That's where the reward mechanism is. It's what helps us naturally motivate for things. But when these drugs come, you have a quick switch on, and then it crashes. And so then people become preoccupied with it, and they want to be coming off of it as soon as possible. Next, recognizing the signs of addiction. We kind of talked about it a little bit. Addiction doesn't come with a label of, hey, this is an addict. No, you can have a very high performing, functioning person. Actually, a lot of the stars you see presenting, they will also be using, and you wouldn't know. So treatment options, there's a lot of medicines. Best thing to do is connect with a doctor. Because of the shortness of time, I'm not going to go into the names of them. I want to quickly talk about the resources and support, because if you have somebody who needs help, the 24/7 crisis support line, 988. That is the number you want to dial. You are more worthwhile alive than dead. We love you. We want you here. So call them and seek help. SAMHSA is America's drug substance abuse disorder main organization. There's that number, 1-800-662-HELP. Ask them, they can help you connect with local resources. And if you want to go to Google, you can type in addiction resources near me. You will see rehab centers, detox centers, etc. And then, of course, I'm at your service. As you know, I'm recently opening up a company, telemedicine. I'm practicing everywhere in California for this because I think it's important, and not everybody approaches it in that way. Also, there is a lot of stigma, not only in the patient and in the streets and in the families, also within the healthcare system. So with that, I appreciate your time and attention.